Welcome everybody. I'm joined this afternoon by the Chief Medical Officer of Australia, Professor Paul Kelly. We're here to indicate that the Australian vaccination program has now reached almost 2 million vaccinations a week, and also to announce the next stage in our Omicron response plan, as has been planned, prepared and anticipated for any surge in either case numbers or hospital numbers. In particular, there are three actions that we're announcing today. Firstly, we are activating the private hospitals agreement. This agreement was established over the course of late March and early April in 2020, and it was designed for supporting state hospital systems at any time where they may have significant numbers. As Professor Kelly and I were just discussing, we have strong confidence in the Victorian hospital system and strong confidence in its preparedness, that there is significant capacity within the system, but of course workforce challenges not just in hospitals but in workplaces in any Omicron affected area remain the principal challenge, and so this is a response to that. The private hospitals agreement will see up to 57,000 nurses and over 100,000 staff made available to Omicron affected areas around the country. So it's a workforce which is skilled, planned, appropriate and available. The states and territories will, where necessary, work directly with the staff and with the hospitals themselves, whether it's the large private hospital networks or the smaller private hospitals. It'll be up to the states and territories to activate those. But we have activated it at the Commonwealth end, and that will mean there will also be assistance available where necessary in any aged care facilities that require that additional workforce. It's one of 5 actions that are available for workforce support within the aged care sector. The second thing that we are doing is that the Australian government, on my authorisation, is activating the National Medical Stockpile to support any states or territories that have shortages of PPE. I have to say, all my advice is that all states and territories are well prepared in relation to PPE. We have provided 160 million units of PPE so far to state and territory hospital systems, to private hospital systems, to aged care, to general practices and pharmacies over the course of the last 2 years. But the National Medical Stockpile is well supplied, well supported, and if there are any shortages, which at this stage we don't foresee, but we are making this available, then that's an important thing. That includes, of course, the 10 million rapid antigen tests to states and territories. The third thing we're doing is providing 10 million units of PPE and related products to the aged care sector and facilities around the country. We have already provided 5.6 million rapid antigen tests, another 100,000 today, which will take to 5.7 million. And a further 3 million to come. So out of those 10 million units, there are 3 million rapid antigen tests, 2 million N95 masks, 2 million surgical masks, and up to 1 million each of gloves, gowns and goggles. And so that's an important additional protection to be made available to our aged care sector. So far, and this is not a figure that I'm aware that has been released yet, we have provided over 2.3 million rapid antigen tests already just in 2022 to our aged care facilities. That then brings me to vaccinations. I want to thank everybody that has stepped forward to be vaccinated, but to all of our vaccinators and those that are supporting the system. We have had 1.995 million vaccinations in the last 7 days, so almost 2 million vaccinations, and we are likely to pass that 2 million mark on a rolling 7-day basis over the coming days. And that's with staff that are furloughed, with people that are still on summer leave. But our GPs in particular and our pharmacies in particular have stood up, and we've had a series of record days for primary care. We're vaccinating at a rate which saw the fastest 3-day period in Australian history on Wednesday, Thursday and Friday of last week in terms of vaccinations. The other things to note, we have now passed over 5.33 million boosters that have been done. There were just yesterday over 241,000 boosters delivered, over 56,000 children's vaccinations delivered, and that number has passed 379,000, and during the course of the coming days will pass 500,000. So our parents are coming forward, our kids are coming forward very bravely, and as has been noted, there are significant vaccination spots available for both adults and children in the state system. So over 10 million vaccines that have been in the field, that are available and are now being taken up in record numbers. The last thing that I want to do is again to say thank you. We have planned, prepared, and now we're activating our next stage today with those 3 areas of action: the private hospitals agreement, the support of the National Medical Stockpile for states and territories if needed, and the additional support in terms of rapid antigen tests and PPE for our aged care sector. Professor Kelly?